Hi, I'm Erin from the Charleston Birthplace, and I'm going to talk to you about epidurals. So an epidural, it's an anesthesia procedure where they go into the epidural space and insert a small catheter which allows them to administer some pain medication directly into the epidural space, which then therefore allows for you to get pain relief, or for a woman to get pain relief in labor. And it essentially goes from right about where the diaphragm is down to their toes. It doesn't necessarily take away the pressure sensation, but it takes away the pain sensation. And so it allows for women to fully relax and their body to continue to work, but their brain take a nap. The biggest downfall to potentially getting an epidural, the biggest risk factors to getting an epidural per se, is that it does have an increased risk of arrest of dilation and arrest of progress, simply because of the fact that it doesn't allow for women to move freely to allow the baby to rotate. And sometimes some women just end up flat on their back, and that isn't the best position that's conducive for helping the baby to rotate. And if the baby gets kind of wedged into a difficult position, then sometimes that can end up meaning that the baby does, they don't continue to progress, and then the baby ends up needing to be born via C-section. The other big thing with epidural placement is that sometimes when anesthesia goes into that epidural space, it can throw off the fluid balance within mom's body, which can then lead to a drop in mom's blood pressure, which can then lead to a drop in baby's heart rate. And sometimes the babies don't entirely tolerate that very well. They counteract that, and really try to counteract that anyways, by giving mom a pretty hefty load of IV fluids ahead of time to kind of boost her fluid load, and then that way when there is that little bit of a shift, it doesn't tend to affect her that much. But it is not uncommon for babies to kind of have a little bit of dip in their heart rates after an epidural is placed, just because of that drop in mom's blood pressure. It can be remedied, but sometimes it's really difficult to remedy, and sometimes the baby's telling us they can't handle that, and so they end up with a C-section for that purpose as well. The other options for pain relief in labor, most of them are non-pharmacologic, like changing positions, and there's TENS units which can help with lower back pain, or sterile water injections that can help with lower back pain. The other big one that we use at the birth center is hydrotherapy, which just simply means using the water. If you think about it, when you're sick and you're not feeling super well, one of the things that you typically do is go and take a bath, and you just tend to feel better. So hydrotherapy, especially while in labor, it allows for mom to continue to be able to move around, which also is going to help with that discomfort. Certain positions are going to alleviate pressure in certain places and alleviate that discomfort in some fashion. It's not going to take it away, but it's going to make it a little bit more tolerable. And they're also buoyant in the tub, so it takes, again, some of that pressure and some of that sensation away. Some women will feel like the water, they call it like a hydrodural, where it is, as effective to them as an epidural. Now that is pretty rare that happens and they feel like the water takes away everything, but it does offer a lot of relief for most people. And then there's also nitrous oxide, which is laughing gas. It is used mostly in the dental world. That's where most people have heard of it before, but it's also really commonly used for pain relief in childbirth in Europe. And we offer it here at the birth center. MUSC does also offer it, but their restrictions on it are a little different. Like, you have to stay in the bed if you're using it. Where here we allow you to kind of freely move around while using it. But the nitrous oxide is really great for giving mom something else to focus on. It's not going to necessarily take that pain away, but it's going to give her something else to focus on and remind her to breathe, to allow her to continue to relax while she's laboring, which is also going to then eventually kind of speed up her labor because she's more calm and relaxed. Pharmacologic-wise, there are IV pain medications that can be given. We use Nubain and Phenergan here, but we typically give that as an IM injection for therapeutic rest, more so than giving it in their IV. In the hospital setting, they offer Nubain, there's Stadol, there's Phenergan, there's all sorts of different type of medications that they use. Sometimes they'll use morphine, it just kind of depends on what that particular facility uses. And then obviously in the hospital setting, they have the epidural.